I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because
sleep matters.
I think it's all these conversion stories start with your own kid, I think. So one of my kids had kind of this history of open mouth breathing, kind of a little bit of open mouth snoring or mouth breathing at night, family history of bedwetting a little bit to where, we just chalked it up to, oh, that runs in the family. It's just genetics. Then you plant these seeds. One of the local orthodontists gave me the book Gasp. And I think when I read that, that is what a light bulb went off, all these things, what Erin was doing, all the things that she talked about, all this early treatment orthodontics that my dad had done years before, looking at my own kid and doing kind of arch development around the age of 12, but still seeing some of this open mouth breathing and stuff that I just couldn't put my finger on what was going on. And reading that book, and it was just like kaboom, all this stuff kind of came together to where I realized, like, holy smokes, this stuff needs to be looked at way earlier than what we're doing. And all these people that have all this apnea stuff at, age 40, who had typical traditional orthodontics at age 12 and have beautiful smiles, but have these kind of weak airways. Like, we missed something. Like, what is it that we missed? So I kind of dove all in and started doing some treatments. And lo and behold, 2 weeks into expansion, we got kids stopping wetting their beds. Like, parents are coming in like, what in the world? You said this might happen, and it totally happened. And then kids are like, I can breathe through my nose. I can blow my nose. Their parents are like, they're sleeping better. They're different behaviors. And I mean, once that happens, once those things happen, it's like Erin said, you can't unsee it's just, so now it's like you just are eyes wide open, kind of looking for it everywhere. So
how much time elapsed from when you started practicing to you had that epiphany?
Do I have to answer that? I feel like that's it. I think probably 20 years.
So what would you say to the guy, the dentist that's getting into practice today? What would you say to yourself 21 years ago? Right? Try to bring that to your attention and open your eyes to it at that time.
That's a really good question. And I think that's a hard one because I feel like you come out of dental school, out of residency, or out of a GPR. I mean, you're just like laser focused on, I got to pay off my debt. I got to get in there and just learn to do what I've been trained to do. And I think the first few years, you're just kind of deer in the headlights, go, just trying to learn and get your skills down. And so you throw something like this in there. If it wasn't in your education component, you're like, why did they teach me this, if this is really that important? And so I think it's hard. I think it takes a little bit to get that. But I sure hope it's something that is starting to be incorporated into the educational arena to where these kids are getting those seeds planted young. And then it just grows as they realize this is something I got to watch out for. So, I mean, early on in our training, it's like, hey, you got to learn to take somebody's health history and determine whether or not their cardiac issue is something I need to worry about. What are the meds they're taking? But they don't ever say, did you ask airway questions? Did you ask anything about that? Even if they just start planting those kind of seeds, like immediately you start to know this is something I got to pay attention to. So if they can get their eyes away from kind of that day-to-day bread and butter and start to feel comfortable with that, I think that's when we can start kind of planting these seeds of how it is important. I do think there's people that are in the adult arena that are just like, hey, this is a moneymaker. I want in on it. But I don't think they're necessarily doing it initially for the right reasons, but ultimately they're helping their patients, which is good. So
it is a labor of love.
We went all in the sense of like, okay, we as a pediatric dentist now have a cone beam. Like, not very many pediatric offices have a cone beam. We got a rhinometer to measure kind of airway, acoustic rhinometry to measure nasal capacity and airway. We bought an iTero, and we're doing scans on these kids and measuring arch widths and showing the scans to parents and talking through all that. So we invested heavily into a lot to do that. And that's tough for a new provider. But you don't need to do all that stuff, I don't think. I think you just need to be asking the right questions, looking for it. And if you're aware of what you're looking for, we have all of our patients fill out a PSQ, a pediatric sleep questionnaire. And if they score high on that, it is like immediately a discussion point for parents.
Sleep matters.